So this was an abstract presented by my colleague Andy Rostron from the Leeds group again, and this was looking at again the same trial FLAIR study and looking at the dynamics of MRD. So what we have been able to show in this trial is the different dynamics with different arms of the trial. So we had the FCR arm, Ibrutinib only arm, Ibrutinib rituximab arm, and Ibrutinib with Venetoclax. What we found in this study is that if you're using Ibrutinib on its own, what we find in the peripheral blood is what we find in the bone marrow. So there's no point in doing a bone marrow. And again, in the Ibrutinib Venetoclax arm, there was very little difference between the MRD rates in the peripheral blood and the bone marrow. So the consensus that we came along was that bone marrow is probably not needed to assess the MRD in patients who have been treated with Ibrutinib Venetoclax. But if we are going to use just peripheral blood, it's better to use a threshold of 1 × 10⁻⁵. And the useful thing to do would be to separate the MRD analysis by 3 to 6 months in order to capture the patients who would benefit the most from the MRD guided therapy.